Welcome and thank you for all the work you do to support your communities. My name is Myra Parker and I'm serving as the moderator for today's podcast. I'm joined today by members of our research project team, Elva Cookie Allen and Christina Ore, to share important results from our work developing an Indigenous systems alignment framework. I'll turn it over to Cookie to introduce herself.
Thanks, Myra. I'm Cookie Allen, and I worked formerly as the director of the Strategic Initiatives and Development Office with the Coeur d'Alene Tribe. I was also a transformation lead for team lead for the Indigenous Systems Alignment Study and a PI for the Tribal Care Coordination Dashboard Study, a community-led research project that we will be covering today.
Thank you, Cookie. Christina, can you please introduce yourself?
Sure, Myra. My name is Christina Ore. I'm an associate director with 7 Directions, which is an Indigenous Public Health Institute, and assistant professor with the Center for the Study of Health, Risk, and Behavior at the University of Washington School of Medicine.
Thank you, Christina. Today, we're excited to share our perspectives on cross-sector collaboration and experiences developing an Indigenous systems alignment framework from 2 studies. The first is the Indigenous Systems Alignment Study, and the second is the Coeur d'Alene Services Care Coordination Study. Christina, can you start us off with providing a brief overview of the Indigenous Systems Alignment Study funded by the Georgia Health Policy Center through the Robert Wood Johnson Foundation?
Yes, thank you. We appreciate this opportunity to share our stories. In 2018, 7 Directions and Red Star International invited tribal partners to respond to a call for proposals from the Georgia Health Policy Center for their initiative Aligning Systems for Health. We came from a public health background for tribal public health accreditation and health research that required a lot of adaptation and modification of existing frameworks, standards, and measures that had been designed originally outside of tribal settings. This was an opportunity not only to adapt, but to start to create a framework to proactively guide alignment from an Indigenous perspective and nurture those strengths, identify barriers, and address them collaboratively. So from 2020 to 2022, we conducted a practice-based qualitative study to examine the relevance and applicability of the Georgia Health Policy Framework for cross-sector alignment or collaboration by Native nations and Indigenous communities. So our study was designed to provide an environment of reciprocal exchange of knowledge among researchers, technical assistance providers, and the tribal transformation teams. This woven into the research component was the technical assistant component, as each tribal partner receives small funding to support existing or initiate new cross-sector alignment projects. Following the completion of the Georgia Health Policy Study, we found that while the Georgia Health Policy Center's framework was a good starting point, there was a need to develop and test an Indigenous systems alignment framework that would include context, historic and contemporary, center tribal sovereignty, and come from a community-centeredness perspective. This is also included an emphasis on tribal data system development. So I'll pass over to Cookie to share the history of our work as this continued, and we've been fortunate to continue our partnership with Coeur d'Alene.
Thanks, Christina. Yes, it seems that we were in the right place at the right time for this work. Working with the Coeur d'Alene Tribe, we had been undergoing their own experience with multi-sector collaboration to address gaps in services in health and public safety for several years prior to our participation in the Georgia Health Policy Study, headed by 7 Directions. In hearing as part of the study, we heard the experiences of the 4 other tribes that were involved in this study, and we observed that initiatives focused on collaboration and services improvement within tribal communities had distinct characteristics. We were eager to pursue more opportunities to collaborate with the 7 Directions team to explore how we could build upon existing frameworks for cross-sector collaboration to better understand these unique qualities we were encountering in tribal communities. And we found an opportunity through the Robert Wood Johnson Foundation Systems for Action program to conduct a community-led study focused on improving coordination, service coordination, and delivery for youth through the development of a customized universal intake and referral system that included informational dashboards. So, our findings from the second study echoed those of the Georgia Health Policy study, showing that an Indigenous framework was worth pursuing, and we were able to build upon that in this project.
Thank you both so much. In bringing together health systems, including public health and social services, it can be a challenging process. What were some of those hurdles in building cross sector partnerships? Christina, do you want to start us off?
Yes, there's systemic inequities that are built into the existing systems. The sectors that make up the tribal government system were established through outside funding, Western laws and policies, and use of Western frameworks that create and perpetuate silos or disconnection. This can be a challenge to existing customary ways of coming together as a community for shared purpose of community safety, health, and wellness that exists within Native nations and Indigenous communities. And this way of knowing goes back to the beginning. So the resulting impact are that service providers, program managers, and staff in each sector are often inundated with their sector's concerns, issues, and limited by confidentiality and privacy requirements. So it's often difficult to know how to communicate with one another, build that trust, and move towards collaboration on the same project. The other impact of disconnection and siloing is a lack of interoperability of data systems. So each sector is using its own software system and platforms to monitor, track, and report. It makes it difficult for community level assessment, system management, and achieving those shared goals and objectives that go across all of the sectors. And finally, some of the impact is working across fields. Each sector has their own language, concepts, approaches, and tools, promising and evidence-based practices. So really communicating and working together can be a challenge, but it's also an exciting opportunity. I'll pass over to Cookie.
Yeah, and another challenge that we encountered in building these partnerships was that because each sector answers to different agencies or boards, establishing accountability can be difficult. In our case, we addressed this by having elected tribal leaders who are responsible for overseeing all governing and service functions of a tribe, and be present at the table. In tribal communities, tribal members often go first to their elected officials because they have a discomfort or mistrust in engaging in public services. So, having the leaders and the representatives from the various sectors come together helped everyone not lose sight of the fact that they were all accountable to the tribal and community members who deserved and were expecting better outcomes. It also ensured that all partners were aligned in prioritizing initiatives and programs that were rooted in cultural knowledge and practices, which is often overlooked in public service delivery. And this certainly also made a difference when it came time to invest in a shared software system in the second study that we're talking about, to be used by all the partnering services, and establishing those interagency agreements on the data that would be collected and shared. It made a difference to have those elected leaders there to help negotiate that.
So ultimately, establishing a cross-sector team for long-term collaborations to achieve the shared vision for community health and well-being takes time, trust, and communication. It takes bringing together people from across many sectors.
And that was certainly the case with our experience. We started our work with the Coeur d'Alene Tribe back in 2015, and it took a good 2 to 3 years before we could really see those relationships among the partners really strengthening. And 10 years later, in 2025, we're still chipping away at that.
Thank you. What were some of the most surprising or impactful findings from the studies? Christina?
Sure. Well, what was really impactful was going back to the Georgia Health Policy Framework as a good start, and yet that call and drive to develop an Indigenous systems alignment project or framework that could be used to acknowledge the importance of relational accountability based on principles and values that come from the tribe. And then also the need for a unified data system or investment and collaboration around tribal data system development that reflect Indigenous data sovereignty and Indigenous data governance principles and actions.
And what we also found interesting was how much the findings of the studies validated that the practice of collaboration in a holistic manner and working to better align systems very much mirrors Indigenous beliefs and practices. In our experience with the tribe, we came together and did what felt most natural, and it just so happened to also fall under the label of cross sector collaboration. But really, these tribal knowledge systems have been tested and honed over thousands of years. They've learned that the quality of the life of an individual is only as good as that of the community as a whole. So partnering and come together to share information, to take collective action was an organic process. We also found that when we came together, there was an overlap in service roles and responsibilities amongst the partners, which allowed us to share and distribute resources more effectively. Together as partners, we were able to experiment with developing and delivering new programs and services, specifically targeting the gaps we knew existed, and our resources have been used much more responsibly and efficiently.
Thank you. That makes a lot of sense. What have you learned in this work that might help tribal health system leaders, clinicians, researchers, and others better understand how to partner within their communities, and maybe also how to partner with non-tribal entities and organizations to better serve the community? Christina, do you want to start us off?
Sure. I think what this both studies have contributed to was really a shift to looking at centering community over the organization and operations of organizations, but really coming from the community centeredness that we heard and that guides the work. And then the strength of relationality or relational connections. We also learned that the connection to community, whether you were a citizen or had worked for years, was really a guiding force. So not to forget that and to come from that starting point. That there's existing systems, they're formal and informal, and that there are resources. They may be limited, but they may be abundant and they may be tangible and intangible. But to really not overlook that when engaging in cross sector alignment or engaging with partners outside the tribal system.
And we also can't stress enough how meeting together regularly and listening to another's stories is data, and we can often provide better understanding of what's happening with the health and wellness of our families and communities if we take the time to listen to these stories from the different sectors who are from the community and have lived there and are aware of the historical and current issues that are happening. Um, we've also taken a closer look at who we partner with outside of our communities to conduct quality cross-sector collaboration and systems alignment work, to ensure that they understand the importance of tribes and Indigenous communities leading the charge, not only to identify where the gaps in services are, but what solutions are worth pursuing and how to implement them most effectively in that community. And finally, we've encountered other frameworks that are helpful in informing and enhancing multi-sector collaboration and systems alignment work. For example, we came across a collective impact framework that also exemplifies the process of collaborating, such as in the development of a common agenda and identifying shared data points and measurements for monitoring progress and trends, and of having mutually reinforced and agreed upon activities and just that continuous communication.
Thank you so much. What would you say are some of the key takeaways from the development of an Indigenous systems alignment framework? What are some of the things that really rose to the top for you, Christina?
Sure. Engaging in internal and external partnership development, that relationship building to support the increase of long term sustained collaborations across sectors. Use of an Indigenous systems alignment framework, so developing, testing, and implementing a framework that is holistic, centers community again, community goals and needs, cultural, Indigenous wisdom and practices, and affirms tribal sovereignty or the political status of Native nations. To do this using participatory approaches, methods, whether it's in research or evaluation, is really critical. We must be sure to invite and prioritize community, again, goals and needs, inherent knowledge, practices, and not marginalize or overlook existing strengths and knowledge that comes from within the Native nations themselves. And I'll pass over to Cookie to continue.
Yeah, and then just like you said, including those Indigenous methodologies like story sharing or telling. I mentioned it many times, but truly, this is where we learn so much as partners about what the real needs of the community were and spoke to us more than even sometimes a lot of statistics and numbers will do. So again, just the taking advantage of hearing what's happening firsthand from people that live in those communities. And I would say finally that it's very important to continue to invest in and support this type of health research. Improving the frameworks that we use will help us in our partnerships across different governing institutions and different sectors, and can help us improve the results in Indigenous communities. And so we really just need to stress that, to really put aside and our kind of inherent, I guess, practice or temptation to continue to work in silos and know that's only going to meet certain problems and not the whole needs of the community.
Well, thank you both so much. It sounds like the Indigenous knowledge and practices are so important, even when it comes to thinking about some of the issues that we're facing today. And it is possible to tap into that knowledge and really weave it into the approaches that communities are using and relying on in order to improve health. So just really appreciate you both for sharing your perspectives, and thank you so much. Keep up the good work.